If you self-fund your employee health benefit plan, there's a good chance you've suspected more than one case of medical reimbursement and billing fraud, and you might have felt powerless to do anything about it. Fortunately, our next guest is here to help you set the record straight. We're speaking with Dr. Merritt Quorum, a nationally recognized expert in medical reimbursement and billing fraud, and founder of WellRithms. He joins us now. Dr. Quorum, welcome.
Thank you.
Well, Dr. Quorum, let's start here. What is your background in this field?
Well, I've worked in the medical reimbursement field for more than 20 years. This includes working with both companies, public and private, as well as large insurance companies. I've assisted in detecting patterns of fraudulent billing using sophisticated algorithms that I've both developed and patented. I've actually written regulations both on the state and federal level with respect to fraud, and I also have been an author in a book that is significant with respect to solutions to stop fraud in the healthcare arena.
Now, bringing it back to fraudulent medical claims, what is the magnitude of this problem? How common is this type of fraud?
Well, it's widely quoted that over 30% of medical bills have errors. And the biggest error of fraud really has to do with fudging and what we would call abuse or inflated medical charges. And this is well over 90% of the fraud that we see and encounter. And unfortunately, this has been largely institutionalized, so it's almost expected in the system, and it's one of the reasons that we have a difficult time controlling healthcare costs today.
You founded WellRithms to help companies combat this type of fraud. How do you help companies with this problem?
Well, one of the things that's talked about is transparency. And transparency is necessary in the fact that if you don't have good data and you don't understand how your healthcare dollar is being spent, it's very difficult to do anything about it. And for self-insured companies that self-fund their employee health plans, a complete report of how their health dollar spent is critical in doing things to decrease their costs. And we work with both the broker and the plan administrator to do this. We also then put together systems and a safety net to make sure that abusive and fraudulent bills are not paid. And finally, we'll actually look at the overall plan design. And most are completely outdated and really are not consistent with today's mandates and reform. So using these three things, we give companies an unprecedented ability to decrease their healthcare costs and provide quality healthcare to their employees.
Well, this is going to be exciting news for many of our listeners out there. Dr. Quorum, thanks for joining us on the show today.
Thank you very much.
That was Dr. Merritt Quorum. Learn more about our discussion at wellrithms.com.